Hi, my name is Anisha. I'm going to be performing my motor assessment. The first thing that I would do when I walk into the room, well, first to start, this is my mother. She's volunteered to be my patient. But if I was actually working or performing this test, the first thing that I would do is I would knock on the room to make sure it's okay to enter. I would introduce myself. Hi, my name is Anisha. I'm going to be your nurse for tonight. As I'm walking into the room, I would perform hand hygiene, and then I would also either close the curtain or close the door to provide privacy. Then the first part of the exam that I would do is I would start with the mentation and cognition, because I like to go in a straight head toe if I can. So I would ask the patient to state her name.
Marilyn Turman.
Okay. And then if you also state the location of where we are.
Clearwater, Florida. We're here at my home.
Okay. And then if you can tell me what time it is right now.
7:30, I think it is still.
Okay, perfect. All right, and then for cognition, I like the method that we were taught, which is to do a simple math test. So I'm gonna ask you to add by quantities of 4, and then I'll tell you when to stop. And you can start now.
4, 8, 12, 16, 20.
Perfect. Thank you so much. All right, so then the next part of the assessment, I would assess the head. So I'm going to, the head and the face. So I'm going to inspect for symmetry, any asymmetry, or anything that's deviated. I would include the nose in this as well, because I could just assess it while I'm looking at it, as well as the eyes for my inspection portion. So I'm looking for any or non-symmetry, like I said, any deviation in the septums, any lesions, any masses, bumps, bruises, discoloration. I would also assess her skin. I'm looking for any discoloration, any unequal distribution, hair placement, any lesions, any wounds, any redness, any bruises. So I will, while I'm doing my palpating part of the inspection or assessment, I'll start from her head and just work my way down. So in her head and her scalp, I'm feeling for any lumps, any masses. Also, while I'm doing this, I'm going to go ahead and be feeling her hair to see the texture. Then I'll go ahead and just start feeling for her temperature. I'll palpate from the backs of my hands and see if she feels hot. And then I will touch for texture with the palms of my hand. I'll touch and see what the skin feels like, the texture. And then also I'll go ahead and test for skin turgor. So I'll touch and give a gentle little pinch on the arms and then as well as the legs. I was initially taught to test the clavicles, but I know that varies depending on, like, if it's an elderly patient with more loose skin. So then the next thing I would inspect, like I said, the eyebrows, the eyes. I'm gonna look in her conjunctivas. So if you can open your eyes nice and big for me, I'm just gonna look at the inner portions of your eyes, okay? So I would look or inspect that area. I don't see anything, and then I would, excuse me, I'm going to test for the TMJ, or I'm just gonna say TMJ. And then I'm going to also test for the masseter muscle. So first I'm going to put my hands right here, just below her cheekbones. And if you can open your mouth just up and down for me. Perfect. Okay, great. And then I'm going to have you clench your teeth or like bite down. Great. One more time. Perfect. So I was able to feel for both of those. And then I'm also going to go ahead and check for her lymph nodes, the 9 nodes. I'll start here in the back, and then I'll do the ones behind the ears, so number 2. I'll do the ones in the front of the ears, number 3. I'll do the 3 underneath the jaw, 4, 5, and 6. And then I'll do the ones on the side of the neck, on the outside of the neck, 7 on both sides, and then 8 individually, so like it says, don't include the carotid artery. Do that. Do that. Also, while I'm doing that, I'm kind of feeling her trachea to see what it feels like, if it's nice and soft and not feeling like deviated. And so I will place my hands, what I'll have her do is I'll have her turn your head to your right side, and then I will put my hand here. Actually, I have some water for you to drink. I can test first of all, when I'm testing for the tracheal, I'm just looking to see if it's off-centered, if it feels any deviation. And then to test for the actual tracheal tug, I saw another way that you can test for it, where you hold the area, or you place your hand just below the cricoid notch, and you feel when they take a breath if it feels like it's pulling. I wasn't completely clear when I was watching the video, like the comprehension of it. So that's one way that I like, because I felt like it was a little bit more clear. So if you can just take a breath for me, in and out. Perfect. And I don't feel any like tugging on it. And then I can also do the way that I saw on the film, which is to have her take a sip of water. You're going to hold the water in your mouth, and I'll tell you when to swallow. Okay, perfect. So I'll take that for you. And then what I'm going to have you do is turn your head back over to your right. And then I'm going to feel right here. And then I want you to take a swallow for me. Swallow your water. Okay, perfect. And then I'm also able to assess the thyroid at the same time to see in that area if when I see it move up, and then feel for any nodules or any lumps or bumps. And visually, I don't see anything also, or I don't, see anything during my inspection. Excuse me. Sorry. So then the next thing I like to do, I have my pen light. I'm going to go ahead and inspect for Perla. So I will just cover her right eye, and I'll start with the left eye. If you can open your left eye as wide as you can for me. And then you want to look directly at me. And then so I'm just looking for the direct light inspection. Good. And then I'm going to do the other eye. Good. Okay. And then I'm going to do, I forgot what it's called, but basically when I look in this eye reacts as well. So if you can open your eye for me, I'm gonna look in this one, and then this one, it does match. And then I'm gonna do the same thing. I'm gonna do this one, and then I'm gonna look and see. And perfect, this one also constricts as well. And then so for accommodation, I'm gonna have the patient look deep or far, straight ahead, and then I'm going to bring something closer. Excuse me, I'm very sorry. And then see if the patient is able to focus. So then I'm going to look at the top of my pen there for me. You're looking at the pen? Okay, perfect. All right, so that's for the accommodation. And then I also want to test for I know what I'm looking for, I just can't think of the name of it. But I know it's above her eyebrows, and then the ones here, her sinuses. So her frontal sinuses and her maxillary sinuses. So I'm going to palpate this area, and I just want you to let me know if you feel any pain, okay? Any pain?
No pain.
Nothing there? And how about in the maxillary? Any pain?
No pain.
Okay, perfect. And then I also want to check for the trigeminal nerve. So I'm going to touch you with a cotton ball. Tell me if you can feel it. So you know what it feels like. Okay, perfect. So then I'm going to test the left side, and then I'll move over to the opposite side. So then,
Yes. Yes. Yes.
okay, perfect. I'm going to switch on over to the other side.
Yes.
Oops.
Yes. Yes.
Perfect. All right. So then I would also inspect the patient's nares of her nose. So what I'd like you to do is if you can lift your nose up, and I'm just going to take a glance in with my light. I'm looking for any masses, any lesions, any bleeding, anything discolored. And you can put your head back down for me. I'm also going to check in her ears for any leaking or like any fluid draining out, any blood. Just take a glance in there. Perfect. I'm going to just take a glance in on the other side. Okay, great. And then if you can also open your mouth for me. So then while I'm opening or having her open her mouth, I'm looking for any cavities, any caries, any missing teeth. Can you move your tongue back for me? I'm sorry.
Excuse me. Move
Sure.
it back. Where?
Just like behind your teeth.
Okay.
Okay. And then perfect. And then I can just look and see if there's any teeth missing that need to be accounted for. Okay, perfect. So then I'm also going to test some more of the cranial nerves. And I apologize, I don't remember which specific nerve it is. I think it's, I'm not even going to guess. But I need you to frown for me. If you can also raise your eyebrows for me. Okay, perfect. And then if you can scrunch your nose up. And then if you can smile without showing your teeth. And I'm also looking for symmetry or asymmetry. And then if you can smile showing your teeth. Okay, great, awesome. And then you can relax that. And then also if you can blow your cheeks up for me, and then I'm going to try to push, but don't let me push any air out. Okay, good. And then the same thing with the eyes. If you can close your eyes very tight again for me, your eyelids very tight. And then I'm going to try to open them, and don't let me open them. Perfect. Okay, great. And then I want to go ahead and move down a little bit further. I'll start to, oh, actually, I need to inspect for tonsils and for her uvula. So I'm going to have you open your mouth one more time for me. I'm going to use my pen light. I actually don't have a tongue depressor, so I can't you do that part. But if you can open your mouth and stick your tongue out for me. Perfect. So I'm going to check for any tonsils. And I actually don't see them. Did you have your tonsils? Oh, I guess I can't really see that because I don't have a tongue depressor. But I can see it when she's able to kind of adjust her mouth a little bit, like her uvula in that back area. So I do see the tonsils. And then I do see the uvula. But what I want you to do is go, ah.
Okay.
Stick your tongue out. Ah. Okay, excellent. Perfect. And I see the uvula back there. All right. So then the next thing I want to go ahead and do is the chest assessment. And so first, the same thing, I'm going to inspect. I'm going to look for any barrel chesting to make sure it's like symmetrical on both sides. I'm looking to see if she's using any of her accessory muscles when she's breathing. Also inspecting for any lumps, bumps, lesions, and I'm watching her respiratory rate. And then I would also take a listen to her lungs. And so I'll start from the second intercostal space, listening with the diaphragm. You just take a normal breath in for me. And inhale, exhale. Very good. Very good. Great. Very good. All right. And as mentioned, since my patient does have a larger breast, I would have her lift them up, or I would either ask if I could just lift it up. If she's more comfortable, if she wouldn't mind lifting them up for me on the side. And then I just take another listen. Okay. And then we're on this side. Okay. And then I can listen. You breath them back down. And then I can listen to the side. And then I'm on this side. Okay, good. Excuse me. So then I would also try to assess the heart really at the same time. And actually, since my patient does have larger breasts, it would be better for me to do this assessment with her lying down, because then it would kind of alleviate some of them, them being in that area. So when listening for her heart, I'm listening for, I'm going to identify the 4 areas of the heart, which is the aortic area, or the area where I can auscultate for the aortic valve the best. So it's going to be in the second intercostal space on the right sternal border. The pulmonic is going to be on the second intercostal space on the left sternal border. The Erb's point is in the third intercostal space, also on the left sternal border. And then the mitral, or the point of the PMI, is in the fifth intercostal space, really mid-clavicular line, or just under the nipple, mid-clavicular line. And so, again, I would also prefer to have her lying backwards, so it just opens the chest up a little bit more. And then things that I'm listening for are any murmurs. S1 would be if I heard any incorrect sounds or abnormal sounds. The S1 would be, it would happen after the S1, and that would be the AV nodes. And then if it was the After the S2, that would be the pulmonic and the aortic valves that I would be hearing a murmur on. And I would assess for those with my bell. So first I'll listen with my diaphragm. And actually, it's 1, 2, 3, and then the fifth one, and I would have her do the same thing. I would have her lift up her breast, and then I would listen in that area. And then also too, if she was lying flat, I'd be able to assess to see if I saw any thrills or any abnormal vibrations in the chest. And I could assess for if I could actually see it palpating from outside. Then let me just put this down. Then I would also have her lie down, but unfortunately I don't have a proper place for her to lie. I could either use my couch, but then I wouldn't be able to assess the other side of the body. So just to forewarn, I'm going to go ahead and have you lay down on the couch.
Okay.
And I'm going to move
this way.
Yes, please. And then I'm going to move some of my tools out of the way and move my chair out of the way.
And we can move the pillows if we need to.
All right. And I can't see the camera, but I really hope this is in an appropriate area. Just take a glance. Okay, great. Great. Thank you. All right. So, of course, if I was in a proper room, it would be a more safe environment. I would have the bed at my waist level to make sure that she's safe. I would keep up the 2 handrails to ensure safety, but this is extenuating circumstances. So when I inspect her abdomen, same as normal. I'm looking for any lumps, any masses, to see for any distension in the abdomen. And then I would do my inspection or auscultating. I was taught to start in the left lower quadrant, the right lower quadrant, work my way around. And once I hear bowel sounds, I would move. If I didn't, I would assess for 5 minutes in each quadrant. Okay, perfect. And then next thing I would do is while I have my stethoscope, I'm going to go ahead and assess for her pulses, the upper 2, just because that way I can put it down. But I'm going to listen for her temporal pulses, as well as I'll feel for them first. Okay, so I'll listen on the left side, and I'll listen on the right side. And then I would also assess for the carotids. So I'd start on one side to prevent occlusion. Actually, if you can turn your head to your left side for me. I'm sorry, I would assess on her right side, my left, and then I'll listen. Good. And I'm going to have you turn your head to your right. I'm going to also assess with my fingers first, or palpate, and then I would auscultate. Good. Okay. So then I can put my stethoscope down. So then for the abdomen, first I would percuss, and then when I place my hand down, I'll put my finger and I'll percuss with another finger. I'm listening for hollow sounds to see if there's air or if it's more dense areas. So then I just would start in the same quadrants, the left and right. Oops. All right. And then to assess for the lip, I would palpate. So I would just do like my normal palpation. And then I feel like I'm gonna have a palpitation. Sorry, that's unprofessional. And then I would feel. Any pain in those areas? And the patient would say yes or no. And then I would assess the liver. So, okay. I'm gonna pass on that one. And then, so next I would feel for her pulses all the way down. So I've already assessed the temporal and the carotid. Next I would assess the brachial pulses. Perfect. Perfect. Then I assess the radials, right radial, then the left radial. And then I would assess for the femorals, and the right femoral, the popliteals, did I tickle you? I already left. And assess for the dorsalis, the posterior tibia, and then the dorsalis pedalis. I hope you can see me. I'm the camera person. And then I can do the aortic artery, which is I have to go above the umbilicus, just over to the left side. And then I would just palpate a little bit more harder. I can feel it. All right. And then I will go ahead and have the patient do some of the musculoskeletal assessment. I would have her, so first I'm going to do your hips. So the first thing I want to do is for abduction and adduction. So what I would have you do is, well, I'm going to switch sides. I'm only going to do it on the right side, but I would do the exact same thing on the left side. So on the right side for the process, I'm going to have you swing your right leg out as far as you can. Okay, great, and bring it back. And that's for abduction. And then for adduction, I'm going to have you swing your leg across as far as you can, or like bend your knee and put it across. Perfect, that's great. You can put it down. And then I'm going to have her do flexion and extension. So I want you to bring your knee up to your chest. Perfect. And then put your leg down and then extend it. Perfect. And then the same thing with the left one. I can at least do that on the left. I just can't have her swing. So you're going to do flexion and then extension. Okay, great. And then for hip rotation, external rotation, if I'm not mistaken, you're going to bend the knee and drop the leg. And then drop your leg this way for me. And like put your foot there. That's external. And then you can put your foot down, because I'm going to X out the internal, because I'm not 100% clear on how to do that one. And then I'm going to have you, I think this next part will be easier if she sits up. If you don't mind sitting up, I can give you a hand. Thank you. You're welcome. Okay, perfect. So then for your arms, I want you to stick your arms out in front of you. And I want you to flex your muscles. Or you can do it to the sides, whatever you're more comfortable with. Flex your muscles and then extend your muscles. Okay, perfect. And then I want you to do internal rotation. So you're going to roll your arms forward. Perfect. And then I want you to do them backwards. Perfect. And then you can put them down. Thank you. What I'd be listening for is any popping sounds, any cracking sounds. I could also feel, so if I feel any crepitus in the shoulders, or that's what I'd be feeling for. Any masses or lumps, lesions, that type of stuff. And then the same thing with the wrist. You can flex your wrist. You're going to bend them down, and then you're going to bend them backwards. Perfect. And then your leg, you can do the same thing. You're going to bend it. If she was in a chair, it would be easier, but I would have her like bend her leg and then extend her leg. And I would have her do it on both sides for the knee. Perfect. And then for your ankles, the same thing. I'm just going to have you go forward and then backwards. Okay. So flexion, extension.
Okay.
Perfect. Okay, great. And then I just want to take the moment to take a glance at my notes to make sure I didn't forget anything, because I'm sure I forgot several things, but just want to double check. So then one other thing that I can do, since she's sitting up, I can go ahead and do my inspection of the chest and my auscultating. So the same thing, I would look for any, actually if I could have you turn as much as you're able to point that way, just so they can kind of see us. And if you're able to scoot a little bit forward for me, if you don't mind. Or more forward, I'm sorry.
Like this way?
No, like scoot your body forward.
Oh,
I'm
okay.
sorry.
Oh, sure, sure, sure.
Okay, perfect.
Okay,
Thank you. That way I know she can see.
Okay, sure.
All right. So then I would then inspect. I'm looking for the same thing as I would as in the front. Any use of the accessory muscles, any lesions, any discoloration, any masses back here, any abnormal bony prominences. The P word, prominences. And then I could also do her vertebral exam. So I would just have you roll forward for me, and then I would just feel up her spine. And then you can sit your neck back up for me. And you just sit regular, and I'm going to listen to your breathing. So I'm going to auscultate. I'm going to put my stethoscope to your chest. And then I just want you to breathe normal. I'll tell you when I need you to take a deeper breath for me, okay? So same thing, I'm going for the intercostal space. I would stop at the top, or start at the top and work my way down to the bottom. So now you can take a breath, just a regular breath. And I'd have you go ahead and take a deeper breath, please. Perfect. Move to my next area. Very good. And then I do the kidney test. So then I would lay my hand flat at the above like the hip area in the like thoracic column of the back, and then I would just thump my hand. Any pain when I did that? And then I do it on the opposite side. Any pain when I did that? Okay, perfect. And then if I heard any abnormal sounds, doesn't matter. And so I could also do the flexion and extension for her elbows, but that's what I would test when I'm having her do the flexion and extension of the arms. For the elbows, that part I've assessed. Then I could also do for strength, I would create resistance. So the same thing with like her arms. If you would, I'll switch to the opposite side. If you could stick your arms out for me, I'm going to put my arms or hands above your hands, and I want you to try to push up on my hands. Thank you. And then the same thing, I would have her push down on my hands. Okay, excellent. And then the same thing I would do with her legs and her feet. I would have her try to push up, and I would do I'm sorry, you can do the same leg. And then, thank you. And then I would have her push down, and push down with the left, and then push down with the right. Perfect. And then that completes my assessment. And thank you so much for reviewing my assessment.
I'd